that we talked about there. Check on these references for yourself. Don't take my word for it. Background. COVID-19 vaccine. Concerns over possible mechanisms of injury. So there's concerns over possible mechanisms of injury, including systemic lipid nanoparticle, and mRNA. And that said distribution before I messed it up with my pen. So distribution here means that this is distributed around the whole body, the systemic distribution. Spike protein associated tissue damage we've looked at before on this channel. Thrombogenicity, starting blood clots we've looked at. Immune system dysfunction and carcinogenicity, potentially starting cancers, which we've also looked at as well. The aim of this systematic review is to investigate possible causal links between COVID-19 administration and deaths using autopsy and post-mortem analysis. Now, of course, post-mortem analysis is the gold standard. You can make no better diagnosis than putting the organ on the bench and getting the pathologist to identify exactly what's going on. And it really is surprising how much post-mortems have been cut back on lately and how few post-mortems have been done in all of these potentially hundreds of thousands, if not millions, of COVID deaths. Surprisingly few post-mortems have been done, which is, I think, surprising. We're lacking this definitive information, but anyway, Nick and co-authors here have put together the key ones that they could get hold of from the literature. Now, up until 18th of May 2023, looked in PubMed and Science Direct, so pretty well all the major published sources. All published autopsy reports relating to COVID-19 vaccination as a antecedent exposure. So when the COVID-19 vaccine had come before the post-mortem. 3 physicians independently reviewed each case and adjudicated whether or not COVID-19 vaccination was direct cause or contributed significantly to the death. So 3 physicians adjudicated, was this death actually caused by the COVID vaccine, or was it a contributory factor? So what were the results? What did they find out? Well, 44 papers that contained 325 autopsy cases and 1 organ restricted autopsy case just on the heart. So basically they found 44 papers covering 325 autopsies. Mean age of death was 70.4 years. Organ systems implemented: cardiovascular, 49% of the deaths, blood system, 17% of the deaths, respiratory, 11%, multiple organ systems, 7%. So most of them were single organ, actually. 3 or more organ systems involved in 21 cases. But remember, this is out of 325 autopsies. So most of them were just really involving 1 organ or the blood system. Now, mean time from vaccination to death, 14.3 days. So 2 weeks was the average time, just over 2 weeks from being vaccinated to dying. Most deaths occurred within a week from the last vaccination. So within a week was the most common. 240 deaths, that's 73.9%, were independently adjudicated as directly due to or significantly contributed to by COVID-19 vaccination. So of the 325 autopsies investigated, 240 were adjudicated to be independently adjudicated as directly or significantly contributed to by the COVID vaccination. And they looked at this. There's a lot of rationale given for this. I'll give some of it. A lot of it relates to the temporality and the plausible mechanisms of action and the pathology identified. So this is hanging together as a coherent whole. Primary cause of death, sudden cardiac death, 35%. What's probably happening here is that there's some damage to the myocardium. It becomes electrically unstable and it starts giving off lots and lots of irregular impulses, and we get a condition called ventricular tachycardia, where there's a rapid uncoordinated contraction of the myocardium without the rhythmic contraction required to generate the cardiac output. Very common cause of acute cardiac death. Instantly recognisable if you worked on coronary care units. You go from the P, Q, R, S, T, nice rhythm like that, and it just becomes chaotic like this. Ventricular fibrillation, and then over time it tends to become finer, and eventually it'll become a line as a person goes into asystole. Pulmonary embolism, noting 12.5%. Myocardial infarction, that's a cutting off of the blood supply. So typically we have the coronary arteries here supplying blood to areas of the myocardium. Imagine this is an area of myocardium. The blood supply is being delivered through these coronary arteries. If there's a blood clot here, then I think you can see that this area of myocardium will be cut off from its blood supply. When the area has no blood supply, it's called an infarct. If it's in the myocardium, it's a myocardial infarct. VIT, the vaccine-induced thrombocytopenia with thrombosis, the clotting, 7.9%. Myocarditis, inflammation of the heart muscle, 7.1%. Multisystem inflammatory syndrome, so affecting inflammation in several organs, and cerebral hemorrhage bleeding into the brain, 3.8%.